My name is Dr. Leslie Snider. I'm the director of the MHPSS Collaborative, hosted by Save the Children Denmark. We are in unprecedented times. As individuals, families, and communities, we are all having to adapt to a very changed daily life. As the scale of the COVID-19 pandemic has reached directly into homes and communities around the globe, we have never been more connected and on the same side as a global community, facing a common threat. We are in this together. And this has the potential to expand our imagination and our global consciousness. One of the ways we see this raising of global consciousness as humanitarian workers in the field of mental health and psychosocial support, MHPSS, is that people are talking much more openly about mental health and well-being as they face new stresses and challenges. The central importance of mental health and well-being to our physical health, to the good functioning of our relationships, our family life, and to how we cope with the challenges and adapt to the new demands of our daily lives within COVID is so clear to everyone. Because fear, anxiety, isolation, and grief are now the lived experiences for us all. Personal experience of losing ways of life, familiar places, being unable to see loved ones and friends, or even the loss of loved ones and friends and their suffering, all of these have the potential to expand our understanding. As we begin to know vulnerability in a crisis firsthand, can we imagine and better understand the experiences of our brothers and sisters that were already in the midst of humanitarian crises? More than 1 in 6 children worldwide are living in conflict zones or conflict-affected areas, and 149 million of those are in high-intensity conflict zones. There are also nearly 26 million refugees worldwide, and more than half of those are children. An even greater number are internally displaced. And they are living in countries and communities that are among the poorest and with the fewest resources to care for their own. In these situations, the impact of COVID-19, of the loss of livelihoods, of school closures and lockdown, is a very different picture than what we see in higher income countries. Imagine you are a family who had to flee your home, your community, and who has lost loved ones, your livelihood, and a sense of security. Imagine you're a child who, because of being on the move, is now living in a strange new situation without your familiar friends, your school and community, the fabric of your former life that made you feel safe. Imagine that you live in a crowded refugee camp where water, sanitation, and basic necessities are scarce and medical services are woefully inadequate. And now the threat of a deadly virus that spreads from person to person is advancing towards you in a situation where you have little control and few options to ensure the health and safety of your family. We recently heard from a colleague on the front lines of providing MHPSS for children in one humanitarian setting, and he told us that for many children, young people, and women refugees, their lifeline had been the ability to access safe spaces where they could come together and express themselves, receive support, and nurturance and a sense of community. Being cut off from those supports now and from MHPSS programming, they are seeing an increase in desperation among children and their caregivers, and even an increase, very sadly, in child suicides. Schooling that provided normality and routine and a chance to study and look to the future has also been completely disrupted for nearly 90% of the world's children. For a child that has endured deprivation and seriously stressful experiences, such as those affected by humanitarian crises, access to education is also a lifeline. It is essential for their safety and their development physically, emotionally, and cognitively. And for some refugee and displaced children, schools also provide them one solid meal a day. And for those in the poorest countries, there's no option of going online to continue learning. It can be that the parent themselves is unable to read, and not able to help with homeschooling. And economic stresses for the family may mean that children are not able to return to school once it reopens. For survival, children may be drawn into the labor force or girls forced into early marriage. So we have to be innovative in this unusual situation, and we need to tailor MHPSS and educational interventions to the context where the most vulnerable live. Laptops and internet may work in some areas, but radio messaging may reach more children in poor areas. Save the Children and the MHPSS Collaborative have developed guidance for parents and caregivers during school closures that are currently being adapted into scripts for radio and SMS messaging. Safe spaces are being used for case management now to help those who are suffering the most, and MHPSS workers are keeping in touch with young people and vulnerable families regularly through the phone. They are finding safe ways to help those most vulnerable and providing critical and life-preserving mental health and psychosocial support remotely and face-to-face when needed. If we are learning anything in these unprecedented times, it is how interconnected we are. The well-being of any of our brothers and sisters is linked to our own. We must act and innovate to preserve every life with dignity and secure all children's access to health and mental health care, to education and loving, nurturing environments during COVID-19. We must find new ways to extend our expertise in MHPSS to help those most vulnerable to cope and recover, and to learn from them about their innovations to sustain resilience in these troubling times. How we respond now is a defining act for our humanity. It will define also our recovery and stability on a global scale, and indeed our future together. Thank you.